Good day. I'm Dr. Caroline Ann Castro from the Philippine Society for Pediatric Gastroenterology, Hepatology, and Nutrition in the UST Hospital section of Pediatric Gastroenterology. Today, I will be sharing with you about advancing a healthy lifestyle for children. First, I want you to remember the slogan Go40, 521, and None. This is an integrated Nutri-Plan for a healthy lifestyle for children. So what does this mean? Go40 stands for maintaining an ideal body weight, which is the 0Z score based on the WHO standard deviation growth curve. 5 stands for the 5 food groups which should be present in a child's balanced daily diet. 2 stands for limiting screen time and gadget use to 2 hours per day. 1 means spending 1 hour at least of physical activity per day. And none means saying no to sugary drinks and bottle feeding. Now let me explain each of the components of the slogan. First, Go40. Why 0? This stands for 0Z score based on the WHO standard deviation growth curve, which is considered the ideal body weight. It is therefore important for all children to monitor their weight, height, and nutritional status regularly with the goal of having a 0Z score. The next component, which is 5, stands for the 5 food groups. This should be present in a child's diet daily. The 5 food groups are Group 1, rice, bread, cereals, and fats. Group 2, your vegetables, leafy and non-leafy. Your Group 3, your fruits of varied colors. Group 4 stands for the sources of protein, which are your poultry, fish, meat, egg, and beans. And Group 5 is your milk. We can follow the Pinggang Pinoy as a guide for a healthy or balanced diet. As you can see, half of the plate consists of your fruits and vegetables, and the other half your carbohydrate sources and your protein. We can also follow the Daily Nutritional Guide Pyramid for Filipino children. These are tools which we can easily access to help guide us on what to feed our children. The next component of our slogan, 2, stands for allowing the children to spend only a maximum of 2 hours sedentary activities per day. Sedentary activities include your watching TV, using computers, and using your gadgets. So it is important to emphasize that we must limit gadget use among school-age children to 2 hours per day. What is sedentary behavior? This is having little physical movement and low energy expenditure. Examples are sitting for long periods of time, using your computer, watching TV, playing video games, and having motorized transportation. What are the effects of having sedentary behavior? This results to decreased fitness, obesity, poor esteem, increased aggression, and even weak academic performance. So what are the recommendations about sedentary behavior? We must replace majority of sedentary time with light intensity activities such as having outdoor activities like walking or biking to school, walking the dog, having active play. Indoors, these are some activities that we can do. So what is the benefit of having low levels of sedentary behavior? This results into improved BMI or body composition, also improved cardiorespiratory and musculoskeletal fitness, and improving your academic achievement and even self-esteem. So in summary, 2 hours or less of sedentary activities is associated with increased fitness testing, decreased risk for obesity, decreased risk of metabolic syndrome, good bone health, good social behavior, and better academic achievement. The next component of our slogan, 1, stands for spending at least 1 hour of physical activity per day. According to international data, physical inactivity or lack of exercise has been identified as the fourth leading risk factor for global mortality. Also, overweight and obesity are responsible for 5% of global mortality. In the Philippines, it has been found that for children aged 11 to 19 years old, 5 out of every 100 children are overweight. So what can we do about this? We should encourage our children to engage in the different types of physical activity. One type is your aerobic physical activity. This is an activity in which the body's large muscle groups are being used in a rhythmic manner for a sustained period of time. This has the benefit of improving one's cardiorespiratory fitness. Examples are walking, running, swimming, and riding your bicycle. Another type of physical activity is your muscle strengthening. This type of physical activity is designed to increase the strength of specific sites in bones that make up the skeletal system. This produces an impact or tension force on the bones. Therefore, this improves your bone health. Examples are running, jumping rope, and lifting weights. So what do we recommend about physical activity? First, children and young people aged 5 to 17 years old should accumulate at least 1 hour of moderate to vigorous intensity physical activity daily. Physical activity greater than 1 hour daily provides additional health benefits. And most of daily physical activity should be aerobic. Your vigorous intensity exercises and muscle strengthening exercises should be done at least 3 times a week. This is an example of a kids' activity pyramid which parents can use as guide on what physical activities is recommended for their children. So these are the benefits of your physical activities. It improves your cardiorespiratory and muscular fitness. Cardiovascular and metabolic health biomarkers are improved. It reduces the symptoms of anxiety and depression by releasing endorphins during exercise. So I wanted to introduce the term accumulation. This refers to meeting the goal of 60 minutes of exercise per day by performing activities in multiple shorter bouts spread throughout the day. This is very important for those children who don't have enough time or 1 hour to spare because of their other activities. So, they can actually have shorter bouts of exercises as long as they meet 60 minutes of accumulated physical activity time per day. With this, they can still get the benefits of your physical activity or exercise. So in summary, regarding your physical activity, this provides fundamental health benefits for children and youth. And children and young people aged 5 to 17 years old should accumulate at least 1 hour of moderate to vigorous intensity physical activity daily. Now let's proceed to the last component of our slogan, which is none. This stands for saying no to sugar-sweetened beverages, or your SSB, and no to bottle feeding. Let us look at the trend in food consumption by Philippine households. Unfortunately, intake of sugars and syrups increased. and consumption of soft drinks increased by 150% between 1993 and 2003. According to the FNRI and the National Nutrition Survey, these are the top 15 commonly consumed foods of adolescents. Unfortunately, sugar is one of the highest, ranking third. Also, your SSB or your sugar sweetened beverage, your soft drinks. Why is it important to say no to these? Did you know that? For every 12 ounces of soda you consume or drink, this contains 10 teaspoons of sugar or about 150 calories. A 20-ounce bottle of cola has about 50 to 75 milligrams of caffeine. And a 16-ounce energy drink contains about 150 milligrams caffeine. So let us remember that water is the beverage of choice for children even during exercise, not your SSBs. Why should we be concerned about our sugar and caffeine intake? Caffeine, about 50 to 150 milligrams per day, among children can cause the following symptoms. First, withdrawal symptoms, decreased alertness, headaches, and increased anxiety. Also, caffeine leads to poor sleep quality, reduced sleep duration among adolescents, and increased risk of tooth decay. Sugar intake also has been associated with tooth decay and dental caries. Intake of your sugar sweetened beverage also has been linked with an increase in your BMI. So other ill effects of sweet sugary beverages are increased risk for your diabetes, heart disease, and even high cholesterol levels. So in conclusion, for a healthy lifestyle, what should we remember? Go for 0, 5-1, and none, and live a healthy and happy life. Thank you for your time and for listening. These are my references for today's lecture. Now let us check if you remember the important points of the lecture by answering the following questions. First, what is the drink of choice for children during exercise? Is it water, energy drink, sports drink, or fruit juice? The correct answer is, of course, your water. Water is the beverage of choice and not your SSBs. Number 2. What is considered a healthy weight based on the WHO growth curve Z-score? Is it -1, 0, 1, or 2? The correct answer is a Z-score of 0. This stands for the ideal healthy weight based on the WHO growth curves. For the next question, how many hours per day is screen time or gadget use allowed? Is it 4 hours, 3 hours, 2 hours, or 1 hour? The correct answer is C, 2 hours. For the next question, what is the minimum number of hours per day of physical activity or exercise that is recommended for children? Is it A, 4 hours, B, 3 hours, C, 2 hours, or D, 1 hour? The correct answer is D, 1 hour. For the last question, how many food groups should be present in a child's daily diet? Is it 2, 3, 4, or 5 food groups? The correct answer is 5. I hope you got all the correct answers. Thank you for your participation.